The other point I wanted to make, as this practitioner highlights, is the importance that role of neurobiology has in facilitating recognition of the embodied effects of traumatic reactions to sexual violence. So as she says, it does harm to their bodies and to their beings. And this bodily harm refers to the way in which trauma registers in the body as well as in the psyche of the individual. So in the heightened startle response and physiological arousal experienced in response to the more sensory-based memories and reminders of abuse. And I think this is significant because it points to a shift from understanding trauma as a psychological concept, as in the mind, to one that through a neurobiological framework is able to articulate a relationship between body and mind. And this is something that the philosopher Susan Egan has written about quite extensively when she's been reflecting on and theorising from her own experiences of being subject to sexual violence. And yet, going back to this sexual assault practitioner and commenting, you know, broadly across the field of sexual assault practice, it's a cautious uptake, a recognition that trauma does indeed have its origins in medicine, and that there is potential for victims and survivors to be pathologised or treated as incapacitated. So what this worker is wanting to do is use, and is able to do, is use trauma in a way that ensures agency and control. And I think, you know, one of the key findings from the research that I did was that the practitioners very much saw this use of trauma as very much part of and compatible with their feminist practices. Okay, I am going to make a couple of final points. So essentially I'm going to wrap up and sum up. And what I'm wanting to talk to now is to make a couple of points about what I think some of the broader learnings from the field could be about how in a very applied setting people are using trauma in their work. So one of those is thinking through, and I think this is quite preliminary work that I'm starting to think through. So I just want to make the points briefly, and I'm hoping that we can continue the discussion when we meet online in May. And one of those points is that as scholars such as Elizabeth Wilson, Megan Warren, and Alimo and Heckman point out, there has been a certain conventionalism surrounding feminist engagement with science that sort of typically, and I'm quoting Elizabeth Wilson, he typically manifests as the orthodoxy that the biological sciences are politically and conceptually inept, and that the goal of feminist analysis of the sciences is to correct ideological error rather than learn from the data that have been produced. And I think that one of the things that I'm interested in thinking through is how these practitioners are using the neuroscience of trauma, but using that and learning from that data in a way that I think shows a potential or a sort of certain insight into how to move past this conventionalism. So, you know, they weren't sort of, they were cautious, they were reflective, they could see some of the potential issues, but they were also very engaged with this knowledge, and as I said, had found it very useful in that day-to-day work that they do with their clients. And the second and related point, and again, I'm just in quite preliminary thinking through these ideas, I'm interested in the possibilities this applied work may hold for reintroducing a non-essentialist biological and material body into feminist work. And I think, and again, I'm going to quote here from Alemo and Heckman, one of the points that they make is that while there's been a tremendous outpouring of scholarship on the body in the last 20 or so years, nearly all of that work has been confined to analysis of discourses about the body. So there's been much less attention. And in fact, sometimes I think it's sort of a bracketing out of the material and the biological body. So I am interested in wanting to think through the way that the sexual assault workers are using the neuroscience of trauma in a way that does reintroduce and incorporate a non-essentialist biological and material body. And I am aware that there is a burgeoning body of feminist new materialist work, and I'm starting to explore those ideas in more detail. To my knowledge, the scholarship, or feminist scholarship anyhow, around sexual violence perhaps hasn't been engaging with those ideas, and that's something that I'm really interested in trying to take further, and something that I would be very much hoping that we can have more of a dialogue and a discussion with when we meet together online in May. So look, I'm going to leave it there. So thank you for listening, and I'm, like I said, really looking forward to meeting people in May and furthering the discussions. Thank you.